The indications for the use of intermittent positive pressure breathing, or IPPB, are increased work of breathing, sputum retention, low tidal volumes, or atelectasis in the presence of secretions. The contraindications to treatment are an undrained pneumothorax. Additionally, you may have precautions such as bullae, bronchopleural fistula, lung abscesses, frank hemoptysis, recent GI or thoracic surgery, TB, or raised intracranial pressure. You would need to discuss with your medical colleagues whether the patient can have an X-ray of their chest prior to treatment, which must have been done within the last 24 hours or since any major events of deterioration or procedures such as the removal of a chest drain. You will need to attach the IPPB circuit to the machine. On the machine end of the circuit, you will need to attach a filter, as positive pressure machines require a filter in the circuit. And we have a filter here. Additionally, there is a small connector which needs to go into the left of the machine. At the patient end of the circuit, you'll either use a mouthpiece or remove this and attach a mask instead. You also have a chamber here which you can put in 0.9% saline for the patient to have during the treatment. 5 ml is normally enough. Your circuit is now ready to go for the patient. You'll need to connect the IPPB machine into an oxygen supply. This can either be through the wall or an oxygen bottle. When you are setting up the IPPB machine, there are 3 parameters to adjust. The patient trigger on the end of the machine here, the flow rate, and the pressure over here on the right. Use the black adjuster here to set the sensitivity of the machine for how easy it is for the patient to breathe. With the flow rate trigger, you'll set it here, lining up with this arrow, depending on whether you want an increased or decreased flow rate. And then this is where you decide the pressure that's going to be delivered on each breath, and you adjust it again here with the black dial. At the front you also have the dial that will give you the reading of the pressure that's being delivered on the treatment. And lastly, at the top is the on-off button, and this will turn the machine on when you're ready to deliver the treatment. When the patient is using the machine, there is also a red override button here which you can use to pull out to cycle into expiration if required. Your patient may be on a face mask for oxygen or nasal cannulae before you are going to treat the patient. You need to make sure you remove this before treating them. And then replacing once you have finished your treatment cycle. You need to make sure that you have a nice seal on the mask during treatment to make the machine work. You need to think about your hand hold, so I'm holding it underneath here to achieve a good seal. So John, we're just going to give it a go now. So breath in and out. Okay, we're going to help you take a deeper breath now, so we're just going to decrease the flow further. Please also be aware, if you're using this machine with a patient who is at risk of retaining carbon dioxide, the machine has been plugged into the wall oxygen, which provides a high percentage of oxygen, and so you may want to adjust the amount of breaths that you give the patient accordingly. There are a variety of patterns you could use for your treatment cycle, varying between a number of consecutive deep breaths or using the flow dial to vary the depth as you go through the cycle. You would adapt according to the patient.